Hi, I'm Dr. Kristen Fox here at DePort Veterinary Hospital. I'm one of the veterinarians as well as one of the practice owners, and I am here today to hopefully give some help on allergies in dogs and hopefully give some good information that can help you with your dogs at home that might be a little bit itchy. So dogs definitely have allergies just like how people can, and we actually see a lot of different variations of how allergies show up. The most common that people usually deal with are more environmental allergies. There's obviously food allergies as well, and we do see both of those types of allergies in dogs, very similar to how it is in people. So dogs can suffer from a few different types of allergies. So the big one that we see a lot of is the environmental allergies. So that includes things that are inside or outside. On the outdoor aspect, things like grasses, pollen, trees, as well as indoor things like molds and dust. We will also see allergies that can be related to different insects, especially fleas. So dogs can get flea allergy dermatitis or that kind of response, an allergic response to any type of a bite, especially a flea. We do also see food allergies or food hypersensitivity. So that usually is linked with a specific protein that dogs aren't tolerating, and that can show up as more GI signs or can also show up as more of the traditional what we think of as allergy signs of scratching or licking, things like that. And then dogs can also have a contact allergy where they've had contact with something directly that has caused a bit of an allergic response on that area of the skin. So with flea allergy dermatitis, those dogs, obviously the most critical thing is treating the underlying flea issue. So we've got a lot of great, very effective products that we use, topical and oral, to clear the flea issue. Once you clear the flea issue and have that part managed, treating the secondary allergic response to that is usually pretty short term. And generally, if you can prevent the fleas from coming back, you've kind of cured that type of allergy response. So sometimes that can be almost simpler in terms of the long-term treatment. If your dog has a contact allergy, which we don't see as much of, that's much less frequent. Usually it's just managing with topical or sometimes oral medications, that initial allergic response, hopefully identifying what the response was in terms of what did have contact that caused it, and then just doing our best to prevent that. So you would know that your dog has allergies usually with having your veterinarian evaluate them and really trying to piece together what symptoms that we're seeing and what the cause is. So this is where a really good physical exam is so important. So if you're seeing symptoms at home, such as licking the feet or licking different areas on their body, scratching, ear infections, skin infections, anal gland issues, or rubbing, scooting, anything of those, any one of them or all of them can definitely be indications of allergies. Sometimes even changes to the skin itself. If it looks red, if they're losing hair, if there's scabs or crusts that are present, all of those are different manifestations of what allergies can look like at home. So as you come in to see your veterinarian, they're going to do a great physical exam, looking at the skin, and might talk about doing some additional testing, but getting a good otoscopic exam, looking into the ears, evaluating the skin, looking in between the toes, all of that is how we can start to kind of narrow down if we think this is an allergy cause. And if it is, then what kind of those headers of allergies do we think is the actual cause of that? And that will go into coming from the season, if there's a seasonality component, has there been, what are we eating in our diets? So a lot of that comes from the history and the information from you as the owner, as well as the physical exam of your dog. So from a diagnosis perspective, a lot of times it is getting really good history. So it's understanding when is this happening, how often is it happening, and are there specific triggers. So if we have a dog that has a big itchy flare-up in the spring, but is great the rest of the year, we're probably diagnosing that this dog likely has a seasonal allergy that's probably related to what's going on outside. If there's chronic ear issues, again, we're looking at what we're seeing on the dog and on the patient and putting that together with the information and the frequency to really kind of put together from a time frame of what makes the most sense. From a testing perspective, we can do certainly different types of cytology where we're looking at a slide under the microscope. We'll do that from looking at debris from ears, looking at skin smears to look at what are we seeing. Are we seeing bacteria? Are we seeing yeast? because that's really going to be evaluating the secondary infections that are coming from the allergies. And so if we're seeing those, that can help give us information of trying to narrow down the cause of the allergies. The other thing we talk about is for environmental things, so the indoor and outdoor things, you can do a blood test that will actually look to see if a dog has a hypersensitivity with that. You also can do skin testing like they do in people. That's usually done by a boarded dermatologist. We here at DePort typically would do the blood test to start. If we're worried about a food component, there are not really good testing for that. There's a lot of testing on the market that they show up that say that they'll test your dog's food allergies. Most of those are not thought to be accurate at all, so we don't really recommend doing any of those testing. If we're suspicious about a food hypersensitivity, we really focus on diet trials, and we would talk you through what that looks like. A lot of times it involves a protein source, a novel protein, a protein source that they've not had before, a single protein diet, doing it for long enough to be able to assess. There certainly are prescription foods that can help with that as well. So that's typically how we approach more if we think it's dietary. And obviously if we were worried, if we were seeing fleas or other signs of parasites, skin parasites or things like that, that would involve further testing to help determine if that's really part of the underlying cause. Usually a flea allergy dermatitis is a little bit more obvious because there's a history of fleas or flea dirt or something that's pointing us in that direction. Yeah, determining the source is usually just putting all the pieces together. And so sometimes I try to preface these appointments that allergies and infections with whether it's ear or skin definitely can be a frustrating thing for owners, and it definitely involves more than one visit. So a lot of times what we're looking for is the response to treatment and making sure we're getting things cleared up in between, so that if you do have a new issue, whether it's scratching or biting their feet or their skin or another ear issue, we know that it's a new issue rather than just the same issue that hasn't cleared up, because putting all those pieces together in that time frame is really how we are able to get kind of more of what we think the underlying cause is. So there's a whole range of dog treatment options, really depending on the level of discomfort for the dog, the severity of the symptoms, and what secondary type infections we might be dealing with. So if a dog has an ear infection, you obviously have to treat the actual ear infection. That's not really addressing the underlying allergy itself that maybe triggered the ear infection. So there's a lot of different layers that go involved with that. If we're dealing with a secondary skin infection, that might need some oral medications. Again, same thing, we got to clear that up to help assess if the itching and the scratching is coming from the infection or the underlying allergy itself. We do have a lot of different topical medications we will use to try to topically treat the skin. We obviously use ear medications and different ear cleaners. And then we obviously have a lot of different options just to help get your dog more comfortable from the itching and the scratching. So sometimes we will still use antihistamines, which can be over the counter. We'll still recommend sometimes fish oil supplements. And then there's, going up from there, different levels of medication that are prescription medications that can be oral or an injection that can just help relieve your dog's itching and scratching so they're more comfortable, and also allowing the skin and some of those secondary things to heal. So the frequency on how often you need to do something is really based on the symptoms and how frequently your dog's having problems. Like I mentioned earlier, we have dogs that maybe have one flare up a year. So once a year we might need to do something, and maybe we do something proactively once we kind of understand that pattern that every spring this dog's going to have a flare up. We have other patients, especially if we're dealing with a combination of indoor and outdoor environmental allergies. Those dogs are needing some type of treatment all year round and trying to manage that a little bit better. And so whether that is doing immunotherapy is where you're actually giving injections or a drop underneath the tongue that is desensitizing your dog to what they're allergic to. That's how they treat a lot of people allergies. Or whether we're just managing the symptoms. It kind of really goes back to the frequency and how uncomfortable your dog is during that. Thanks so much for spending some time with me today talking about your dog's allergies. If you have any questions, feel free to give us a call. We'd love to see your dog for an exam and hopefully get them feeling better and getting their allergies in a better spot.